My name is Dr. JJ Rawlinson. I'm the Senior Manager of Community Partnerships and Welfare Initiatives at Wallace-Annenberg Pet Space. We are very excited to bring you the second of a special two-part wellness workshop. This series, our wellness workshops, are designed to directly help you strengthen the human-animal bond between you and your pets through the guidance of animal experts who explore practical, everyday issues for pet parents. If you missed the first session with Dr. Scherk, you can find the video on our Watch tab on our website. This evening, we are excited to welcome back Dr. Margie Scherk, whose many accomplishments include the founder of Cats Only Veterinary Clinic and a role as the North American editor of the Journal of Feline Medicine and Surgery. She will be debunking a variety of myths about cat ownership and care. So I'm really excited to hear what she has to say. We will begin with a presentation from Dr. Scherk and we'll have time for a Q&A session afterwards. So please hold your questions until then. Before we begin, just a quick reminder that we have resumed offering in-space programming and adoptions by appointment. So visit our website at annenbergpetspace.org for more details. Now I am pleased to introduce Dr. Margie Scherk. Margie graduated in 1982 and opened one of the first cat clinics in North America in 1986 in Vancouver, Canada. She became a board certified feline specialist the first year examinations for this specialty became available. She has published several clinical trials and has written and edited numerous books and book chapters. She is an active international speaker and enjoys teaching online. She co-edits the Journal of Feline Medicine and Surgery. Margie has served extensively in the American Association of Feline Practitioners, as well as other veterinary organizations. Her interests include all things feline, especially analgesia, seeing an end to decline, the peculiarities of the feline digestive system, and enabling more positive interactions with cats. Please join me in welcoming Dr. Scherk.
Thank you, JJ. I really appreciate that very gracious welcome. For those of you, I'm delighted that people are here from all around the world, or at least were last week. So I think that still counts as international.
Absolutely.
This is good. Now I do want to let you know ahead of time. I hope you have a little bit longer than an hour because I really do want to get to questions. But this is actually I was spending a bunch of time today trying to shorten this presentation and wasn't particularly successful at doing that. So let me just share my screen with you, and I will now get. Oh, this is interesting. Okay, I will, there we go. Is that looking right there, JJ? Excellent.
It looks perfect.
Okay, thank you. So what I want to talk about is our myths that a lot of people, and the first time I gave this presentation was to a group of veterinarians, and I had veterinarians coming up to me saying, you know, I didn't realize that was a myth. And so this is an opportunity for veterinarians, veterinary team care providers, and just, you know, those of us who love and live with cats. So let's get moving here. Once upon a time in a land long ago, in a land far, far away, something amazing happened. And that is, you know, the cats came, life started out on the ocean and cats evolved, which is really kind of neat. Now, the first cats that are on record are Felis sylvestris libica, and they still exist in parts of Africa. And so this is one of the very, very first cats. They evolved, cats evolved or were first found in what's called the Fertile Crescent. So around Mesopotamia, which is, you know, Turkey and Northern Africa. This is where cats actually came from, in this pink area here. And initially, of course, they came to hang out with people because when people started storing grain, small rodents decided that this was a great place to eat. And so this attracted cats, and cats killed the rodents. So people were very happy to put up with cats for many, many millennia. In fact, they not only were willing to put up with them through, after the times in Babylon, through Egyptian times, they actually became deified. And so that they were, there are lots of mummies of cats that, some of the stuff's pretty gross, but it is, it's the way things are. So let me just fiddle with this here for a moment, because I'd like to get rid of this completely. Let's hide that. Okay, apparently I can't do that. Okay, so ancient Egyptians might have given cats the personality to conquer the world, is the heading on this neat article, where it talks about, a cat in a domestic setting eating under a dining table. And this is in the Ashmolean Museum in Oxford, England. But then they had a bad turn, and they started being associated with witches, and so cats ended up being burned at the stake, just as they were, just as witches were being burned. Then along came the bubonic plague, and they still thought that cats were bad news, as opposed to the fact that cats were actually killing the rodents that carry the fleas, that carry the organism, the bacteria that causes bubonic plague. So that was really a bad decision on the part of people, but they didn't know better. Then again, there was the Renaissance, and cats started being loved again and showing up in all kinds of paintings, even the Mona Lisa. So cats evolved, came out of now in orange, the Fertile Crescent, and then evolved in different, went to different places with sailors. So commerce spread cats around the world. And in so doing, a number of different lineages of cats evolved. Cats, however, are still not domesticated. They tolerate us. They put up with us. They enjoy and love us. I'm not being sassy about this, but they are have been largely unchanged. Unlike cattle or horses or dogs, where in dogs you have these extreme differences in size and shape, and because some dogs were designed to go down badger holes, such as dachshunds, or some dogs were designed for hunting or for retrieving, or for as lap dogs. We don't have that in cats. The changes are very minimal. And so there are these 4 broad genetic groups, breeds from the Mediterranean, Europe, Asia, and Africa. And you can see on the right-hand side where these, the different breeds that we recognize now essentially have the mix where they've come from. So, my question to you, because I assume you have a cat or you wouldn't be participating in this tonight, I wonder what type of cat you live with, and just have a look for a moment and see where they came from. So there are a lot of different cat myths, and one of the ones is certainly that cats have 9 lives, and we've got all kinds of different myths about cats. And so we're going to go through fact or fiction and bust some of these myths. The first one is going to be cats are low maintenance companions. I'll know when my cat is sick. Indoor cats don't need to be vaccinated. Vaccinating a cat with an upper respiratory tract infection or some other disease won't be effective. Indoor cats aren't at risk for fleas and ticks. Cats don't get heartworm. It's better for her if she has 1 litter before being spayed. Pregnant women should get rid of their cats. Cats will only eat as much as they need. Cats can be vegan. It's best to feed cats raw, that cats need milk. Carbohydrates are bad for them. We're going to look at all these things. You can't train cats, or dogs are smarter than cats. It's hard to change people's behavior. If they're purring, they must be happy. Cats have 9 lives and they always land on their feet. Cats hate dogs, water, other cats, people, etc., etc. Cats can see in the dark because they're nocturnal. So let's look at some of these. Cats are low maintenance pets. I talked about this last week when I talked about optimizing care for the indoor cat. And one of the thoughts many people say is you can leave cats alone over the weekend because they're self-sufficient. Their needs are basic. They need good food, water, clean litter, and a place to sleep. These things are true, but cats need a lot more than that. In fact, again, from last week, I talked about the American Association of Feline Practitioners and International Society of Feline Medicine feline environmental needs guidelines. And the second pillar of these 5 pillars of environmental needs are to provide multiple but also separated key environmental resources. And also last week, I showed this checklist that you can go through, and you can get it at cliniciansbrief.com to look at which resources cats need, and structural features, social contact, as well as body care and activity. Some people also think that, cats don't need to go outside. They're perfectly happy inside. And that certainly may be true for some cats, but they actually haven't evolved they've not evolved to be indoors 24/7, nor to be with us 24/7. And there are risks and benefits of different lifestyles, indoor, outdoor, or indoor only. So we have to focus on whether their species-specific needs are met and look at what the role of distress might be in illness. And I showed this chart, and I won't go over it. The increased risks from going outside's on the left, and the increased risks from living indoors, which is significantly longer. So because, physical and psychological health are not separate things. These are this on the right-hand side is a screenshot from the cover of the slide of the presentation last week. And on the left is a document that I sent over so that anybody can have that should they wish it. All right, so the second one, many of us think we know our cats really well, and they'll tell us when they're sick. Well, cats are masters of disguise. And this is because cats have evolved to fend for themselves, because they eat small birds and mice, which they cannot share with others. Because they can't share them with others, it means that they have to hunt alone and eat alone. And this means that they need to be to protect their territory, because the territory centers around their resources. Because of that, because they have to feed themselves, they therefore cannot rely on somebody else to bring the groceries. So they have to pretend they're just fine so that they can continue to hunt and feed themselves, and also so that somebody else who's bigger and stronger and healthier doesn't beat them up and take the resources away from them. So cats are really, really good at hiding illness. And a good website for this, Have We Seen Your Cat Lately? And this is the Australian website, make sure you go to that one. And in the cat risks are hiding in plain sight, the health and wellness looks at the subtle signs of sickness. So looking at the 10 subtle signs of sickness. And these subtle signs of sickness include inappropriate elimination. So urinating or defecating in places other than the litter box. Now that can be just to point out to us that they're having a problem, because if they keep urinating and defecating in the litter box, we're not going to know that there's a problem. Additionally, it may be because they have an urgency, or because they have a need to mark territory because they are distressed. So anytime a cat eliminates inappropriately, it's never out of spite. It's always out of distress, and it could be physical distress or psychological distress, or both. Changes in interaction with us, where they're more clingy or less interactive, or the way they interact with us, the way they talk with us. Changes in activity, being more active or less active. What's going on? Because in an older cat, if they all of a sudden become more active and are losing their excess chub really nicely, you got to wonder about, unless you put in other changes, about illness such as hyperthyroidism. Changes in sleeping habits, that they may sleep in a different place, or they may have a hard time getting comfortable, or they really, really sleep soundly, whereas before they would notice what you were doing. Changes in the amount of food and water that they're taking in, or the way in which they're taking in the food and water. So instead of nibbling, they gorge the food, or vice versa. And similarly with water, they may be hunting for it more, they may be drinking more of it. That these are things that are subtle signs of sickness. Having bad breath, of course, that could be from their mouth, but it could also be because cats groom themselves from their anal glands. It could also be because it comes out of, breath. It could be from their lungs as well. Unexplained weight loss or gain are things that we need to look into. Change, even if it's positive, changes in grooming, where they're grooming themselves more or grooming themselves less. Hairballs are always a sign of a problem. Signs of distress and stress, like with their whiskers, their ear posture, their tail flicking more than usual, and changes in vocalization, maybe nighttime yowling, or which could be a sign of many, many different things, or even having a different sounding meow. So changes are the key, and this is where you are your cat's best advocate by really knowing how they behave and what they do and what's normal for them. Because unless you know what's normal for them, you can't tell if there's a change. And what I try and teach veterinarians and veterinary team members is when a pet parent says, I don't know what's off, but something's off, that's significant. That is significant. Even if you can't find something on physical exam, there's still something going on. So again, we have this belief that cats are self-sufficient, they have few needs, and they're low maintenance, when in reality, they're solitary hunters who have to protect their territory. And they protect their territory with urine marking, with scent, with urine marking, with visual marks from their claws, with the pheromone from their pads, pheromone from their cheeks, pheromone from their heads. All of these things are involved, and I'm sure you've seen your cat doing that. All right, indoor cats don't need to be vaccinated. Yes, they do. First off, we need to define what indoors only is. This cat never gets grass or soil under his feet. He's sitting in an apartment hall right there, apartment building hall, but he goes down to the next door and goes into their apartment and visits with their cat and dog. The dog happens to go outside. These cats never get soil under their feet, but they go out on the balcony. And the balcony, there could be bats, there could be squirrels, there could be birds, and these are, so they aren't strictly indoors. Also, cats may be, even if they're in a catio, they may be exchanging aerosols with other cats. They may also travel. They may also board somewhere. And so it's really important that instead of thinking, when I try and teach people, instead of asking, is your cat indoors or outdoors? I want to know does your cat go outside or have contact with other animals? And also, who else lives with you and your cat? Because it could be that your daughter's just moved home with her cat, or you're taking your cat to grandma's while you travel. Oh, I look forward to traveling again. While you travel to somewhere else, and the cat then is all of a sudden going outside or is being housed with other cats that she or he gets along with very well, but they go outside. So we don't want cats to go viral. And this is, even though we don't, they're really in different parts of Canada, including Alberta and British Columbia, we don't have rabies. It still can happen. So it's very, very important to pay attention to this. So just last year, the American Animal Hospital Association and the American Association of Feline Practitioners redid feline vaccination guidelines. And I'm not going to go through this table, but just like we're looking at with COVID, you certainly get your first vaccine and then you get boosted 3 to 4 weeks later, or whatever interval they're saying in your area. And the core vaccines that all cats should get, whether they're indoors or out, are those vaccines against colds, namely herpes virus and calicivirus, panleukopenia, also known as feline distemper, which is a flu-like thing. Feline leukemia virus, they should be getting that as well as kittens, even if they're indoors, because it's kittens who are most likely exposed. And they're also the ones who most likely are going to, might jump off the balcony or investigate. Plus also, sometimes we change our minds about where we're living and or we move or how not where we're living, but we change our minds with how we want to keep our cat, or we may move. And when we're moving, I don't know about you, but top of my mind isn't, gee, is my cat vaccinated appropriately for where we're going? So in rabies, depending on law, it is core. All right, and then after they're 6 months of age, you can see which things need to be revaccinated. Now, there's also, as we've all been, cleaning everything like crazy, having disinfectant wipes and wiping our hands with disinfectant all the time and wiping surfaces. That's because of fomites. Various viruses, various bacteria can be transmitted on our cell phone cases. They're absolutely filthy, believe me. On brushes that we may share between different cats or pets, on mugs, on door handles, all those sorts of things. And so if a cat is sneezing, and you've been somewhere that a cat has sneezed, you didn't see that cat sneeze, you didn't even see that cat, but those organisms will still be in the environment. And so cats who live strictly indoors don't have the natural exposure of low-grade constant re-immunization through being through encountering this virus on their own. So when we bring things home, they're actually more vulnerable. And this is, from the Lancet, showing where lots of fomite surfaces are in our homes. So we want to, in order to avoid serious diseases, even indoor cats can be at risk for dangerous disease. Regular vaccinations can help keep them protected. What I'm showing in that picture on the right-hand side is that we're trying to give cats treats and reward them at all stages of whether we're vaccinating them, whatever we're doing. We want to give them treats and so that they have a lower stress experience. So what about other medical attention? Well, cats, even indoor cats, need to be examined regularly. And we tend to examine kittens, and in the first year of life, we tend to have lots of exams, and then maybe we examine them every year or every 3 years when they're due their vaccines. But they still need to be examined annually or even twice a year, depending on age, regardless of whether they need vaccines or not. At those visits, we want to make sure that we talk about nutrition and behavior. Has anything changed? What's your cat, exactly what are you eating? So when you go into your veterinarian, use your phone, take a photo of the bags and the cans of food that you're feeding, because that way you don't have to remember, and that it's well known what they're getting. Disease screening in kittens are up to about 6 months or a year of age. We're only going to do those tests according to their health status, so if they need it. Similarly, up until about 8 years of age, we're really only going to do it if they're ill or injured. After that, though, we want to be checking doing blood work and blood pressure and urinalysis every year until they're about 11 or 12. And after that, we want to do it twice a year. As well, we want to get x-rays once a year so that we can pick up kidney stones early, because cats don't tell us when they're having a problem. And the earlier we pick those stones up, the earlier we can accommodate to help prevent them from getting bigger. So this is a slide I showed last week showing that, stress causes illness. And we can also have, just from stress, we can have illnesses, or we can have sickness behaviors be manifested. So the cat will look as if they're physically sick, and they are. We have to stop separating them. But the reason they have these physical ailments is because they're under stress. And that includes things like vomiting, diarrhea, if you think about, Crohn's disease and how that affects us as well, decreased appetite or complete anorexia, even fever. You can get a fever just from stress, decreased activity, increased sleeping, decreased or increased grooming, lethargy, and decreased interactivity. So you want to, these are all things where we need to be aware, that that's why we need to know what's normal and what's changes. So even if things can't be found physically wrong with your kitty, this certainly could be is a very real scenario. Another myth is not to vaccinate sick cats because it won't be effective. That's actually not true. And when the World Health Organization goes into underdeveloped or developing nations or developing areas, they are going to, because they're only going to be there once every 3 or 4 years, as long as you don't have a fever, you are going to get vaccinated. So really, this is where we wouldn't want to vaccinate this kitten, because this kitten won't be eating. This kitten's just focusing on breathing. And so that we're not going to vaccinate. But the kitten on the left, he's got a little bit of a cold. We absolutely should be vaccinating. Now, what about when we spay or neuter them? There's been some discussion that, oh, you shouldn't be vaccinating when you spay or neuter because it's not going to, that vaccine isn't going to take. Again, that's not true. In fact, looking at feral cats who are under a great deal of stress when they're trapped and neutered, they're also dewormed, and they're also getting vaccinated, and looking at antibody titers before surgery, as well as 10 weeks afterwards when they trap them again, they found that there was a nice robust increase in antibodies. So definitely not something we should stay away from. Now, what if a cat is FELV or FIV positive, feline leukemia virus, or feline immunodeficiency virus positive? That also is not a reason to not vaccinate them. Now, if somebody is FELV positive, we're not going to vaccinate them with an FELV vaccine. That's pointless. However, even when you have cats with either of those two retroviruses, if they're asymptomatic, they respond just fine to vaccination. All right, the fifth one, no matter where you are in the world, this is the first one, that was Hamburg. This is Shanghai, and this is Vancouver, where I live. This is, indoor, people believe that indoor cats aren't at risk for fleas or ticks, and they absolutely are. Let's start with fleas. They're everywhere. Cats who are at high risk are cats who go outside, cats who live with other animals who go outside, and cats living in pet-dense environment, i.e. apartment buildings. So this is, you definitely, indoor cats are at risk for fleas, and therefore even cats who do not go outside should be treated preventively on a regular basis, monthly or every 2 months or every 3 months, depending on the product you're using, for fleas. Okay, and so you'd think, well, they're easy to find, especially on a white cat, but they aren't. And that's because the clues, the flea dirt, because cats are so fastidious at grooming themselves, and they've got all these lovely little barbs on their little combs on their tongue, they actually get rid of not only the fleas, but the flea dirt. So when you see flea dirt or a flea, you know the cat has fleas, but not seeing them does not mean that the cat isn't affected by them. And the consequences of flea infestation, it's not only itchiness, it can also be blood loss, as shown in the upper right-hand corner, where that cat's gums are very pale. It can also be an allergy that develops either on the chin, as you saw there, on the eyebrows region, on the nose, that can be flea allergy as well, or you can even get an eosinophilic granuloma on the lips or other places on the body, and they are manifestations of flea allergies. All right, well, let's look at ticks now. Now, when we go outside, even with our indoor cats, the cats are staying inside, or maybe they're adventure cats and they're in our backpack, something like that, whatever. But we go outside, we can bring ticks home. Now, this is a map of Canada. I hope you recognize it as such. And this is where I live, right here on the left coast. In Vancouver. And when we look at, and you think, well, it's a pretty cold country. Again, depends on what region you're in, but it is a pretty cold country. Yet in British Columbia, so in the province I live in, these ticks were submitted. The main tick habitats being wooded areas, leaf litter, and tall grasses. They found that you can see the breakdown of the type of ticks at the bottom, and at the top you can see that of those ticks, 6% were found on cats, more on dogs, no question. And we're seeing also, in the United States, loads and loads of ticks, and especially in those areas that are in the darkest of blue, and then the next blue. When we go to, oops, that's not showing up in, when we go to Europe, there are ticks all over the place there as well, in different regions. Ticks attach to a person or a pet or items of clothing, and they hitch a ride home. Some ticks prefer to set up house inside homes. You know, they prefer actually, they're just getting a ride in. They aren't even going to necessarily bite the dog or bite the person. They're going to, you know, come into the house, and they can stay for up to a few days, and they can be active all year round. This depends on which species of tick it is. Of course, Lyme disease is the poster child of a zoonotic disease that we can get, like where people get sick from an organism carried by a tick, but different ticks carry different things, and different, you know, and these are sort of the hallmarks of tick-borne disease is a rash near the bite site or a red spot, maybe progressing to a full body rash or neck stiffness, having headache, nausea, weakness, muscle or joint pain or achiness, and fever. Very, very serious. But what's really important, this was from 2018, is the range expansion of tick disease vectors. So the vectors being the ticks, and they're carrying the different bacteria and rickettsia and different things like that. And what's happening is ticks have been expanding their geographic ranges in recent decades, largely due to climate change. Furthermore, tick populations in many areas of the past, of their past and even newly established localities have increased in abundance. Additionally, they hitch a ride on birds. So when birds migrate, they can come in with birds as well. And the same thing's happening in Europe, where the TBEV stands for tick-borne encephalomyelitis. So we have to be very tick aware, whether we're the ones going outside on our own or whether we're taking an animal with us. But these ticks can come in, and you can see on the right-hand picture on the cat, they can just kind of look like a wart-like thing. And we need to be very careful removing them with a tick hook and making sure we get the mouthpieces. In fact, the organisms that ticks carry, in this case, Borrelia burgdorferi, has been just recently, this last year, a case report was published in the Journal of Feline Medicine and Surgery, where cats developed heart disease. 2 cats developed heart disease associated with this. And there's a lot of different, these are the three main ticks that are seen in North America, but but very different in different parts of the world. And the pathogens, the organisms that those ticks carry, you can see on the right-hand side. And some of these are really, really toxic. So now I'm going to see whether I can, with F3, get to this one. Companion Animal Council, there we go.
Well, there's a number of different myths that have developed over time about ticks and how they infest and who they infest. One common tick myth is that cats don't get ticks. It's often said that they won't have ticks because they groom them off, but it's actually not true at all. Cats are very susceptible to tick infestation. The ticks, once they attach and bury their mouth parts down into the skin, they're quite tenacious. They hold on. They're difficult to dislodge. And so cats are susceptible to tick infestation and can even develop fatal tick-borne infections following a tick infestation.
All right, so I hope we're back at the main screen here. The PowerPoint
looks perfect.
Thank you, JJ, for reassuring me. So while cats aren't likely themselves to contract rickettsial disease, they certainly can get anaplasmosis, cytoxoonosis, which is virtually, well, we now have some idea how to treat it, but it's still very, very serious and more likely to be fatal than not. Ehrlichiosis, tularemia, and rickettsiosis. So while it isn't likely, it is possible. All right, and if we were in the same room, I'd ask you this question: what's another name for flea dirt? JJ, you want to give us that one? Maybe not. It's called frass. So frass is another name for flea dirt. That's that stuff that, you know, when it comes off of cats, if you put it on white paper towel and you get these like little black curlicues or dark brown black curlicues and dots, when you put water on it, it turns into blood, because it is the cat's, you know, it's digested blood that went through the flea. And what's the organism in frass that can cause zoonotic disease to us? Well, that is uh, Bartonella henselae that causes cat scratch disease if you have a competent immune system, where you'll get really swollen lymph nodes. Whereas if you have, if you're immunosuppressed due to, for whatever reason, you can develop bacillary angiomatosis or bacillary peliosis. And this is from the flea dirt, like the organisms are in the flea dirt that can be caught up in cat's nails, so that and hence the name cat scratch disease. So the way to prevent people from getting sick from flea dirt, from fleas or from ticks, is to use regular flea and tick prevention on cats. And as well, because there are other organisms, we also want to take care of and eliminate internal organisms that cats can carry and transmit to us, such as Toxocara cati. 14% of Americans are seropositive, meaning test positive for Toxocara, and we want to prevent soil contamination by pet feces. We want to deworm puppies and kittens preventatively. And there's a whole bunch of different papers on this. This is we know it shouldn't be. It's pretty much a no-brainer. Just deworm. Just use a broad spectrum dewormer for internal and external parasites on a regular basis in cats, and then everybody is happy. Because even for indoor cats, like houseflies and cockroaches transmit Toxocara. Mosquitoes that come into the house, they transmit heartworm. Fleas transmit not only Bartonella henselae, but also Mycoplasma haemophilus and other things like that. And ticks can transmit all of these other things that they or we can get sick from. So we want to make sure that we are just deworming regularly for internal and for external parasites. All gross things here. And Toxocara cati in cats and humans, what you need to know, the impact on human health, the conditions that we can get from them, visceral larval migrans and ocular larval migrans, which are as nasty as they sound. And treatment and prevention, just keep cats, this is not a big deal. The American Association of Feline Practitioners put out some really good zoonosis guidelines 2 years ago. And in it, they say that humans are unlikely to acquire diseases from healthy adult parasite-free cats. Preventing infestation on a continual basis prevents problems for both cats and their people. And so we do that by deworming kittens at least 3 times initially, and then monthly until they're 6 months and older, and then treating adults with a broad spectrum product year round, or perhaps if you're in Alaska, seasonally. And here are just some different, you can look back at these and use the scoring system on the left, and you read the infographic on the right. I'm not going to go through those right now. But another myth is that cats don't get heartworm, that it's a dog disease. And in fact, a study by the American Heartworm Society showed that 25% of cats that tested positive for heartworm were considered by their people to be indoors. Why? Because that's spread by mosquitoes. And it results in pulmonary disease that looks a lot like asthma. So chronic respiratory disease, anorexia, weight loss, and vomiting. So even, and wherever dogs can get heartworm, cats can get heartworm. And so it maybe in your area, there's no, like in Vancouver, we don't have heartworm in dogs, but people travel, and they may travel with their cats, especially now trying to get to nicer, get out of their apartment and the like. So, we've talked about, what are the health needs of the indoor cat? We've talked about, that. Do they need to be vaccinated? Can indoor cats be indirectly exposed to viruses? Yes, they can. Do they need to be dewormed? Do they need external parasite protection? Do they need regular examinations? Do they need disease screening? Yes to all of those. Okay. The 7th myth here is that it's better for her if she has 1 litter before being spayed. Well, that's just a disaster from a numeric perspective, because, 1 cat can be responsible for, like, after 8 years, for 2 million cats. And this is it's really important from pet population control that we spay and neuter cats. This is 1 queen. Now, what happened if it's a tom, a male cat? It's a much larger number than this, much larger. And where does this myth come from? Well, hopefully I'm not going to offend anybody with this, but I'm a real fan of Mrs. Maisel. And she, she says, women are supposed to be mothers. It's supposed to be natural. It comes with us, right? The equipment is pre-installed. And so we have this myth that, that all women should be mothers, and that cats should have a litter. And it's simply not true. In fact, there's a big push. Veterinarians are slow to catch on with this, but there is a big push to fix by 5 months. So even as young as 8 weeks of age, there's some real advantages to doing that. It's a quicker surgery, it's easier on the cat, et cetera, et cetera, et cetera, whatever, lots of different things there. But we definitely want to spay and castrate them before they reach puberty. It does not affect growth rate. It does not affect the diameter of the urethra. And then, but we'll talk in a moment about behavior. So there's been a lot of thoughts about, well, they're more likely to have hip dysplasia or symphyseal problems, that they're more likely to get blocked. That simply isn't true. We thought that was the case. We know better now. Now, when we look at behavior, this is an old, actually a fairly old paper. There are newer things out there looking at when cats who were at least 2 pounds, but under 5.5 months, following them along throughout their lives, were spayed or neutered at this young age. Among male cats, the occurrence of abscesses, aggression, at least towards veterinarians, sexual behaviors, and urine spraying was decreased. And also among male and female cats that underwent early age spaying and neutering, asthma, gingivitis, and hyperactivity were decreased. But I think it's a bit of a mixed bag, and this is why I said behavior, because hiding was increased and shyness was increased. So I'm a little bit leery about that, and we need to work on that. So some of the concerns are that the cats, because they're so little, they may get too cold, they may have low blood sugar. We have to choose the appropriate anesthetic agents, but it's a faster surgery. There's no fat layer, it's a smaller incision. And so 3 cheers for the NBA, not that NBA, this NBA, neuter before adoption. Now, this is a really big one, that pregnant women should get rid of their cats. And when I was pregnant the first time, this was, I couldn't believe when I went to prenatal classes, they were still saying this. And they were saying that, you couldn't, and you shouldn't drink. The other thing they said to me was that I just thought was ludicrous, was you shouldn't drink herbal teas. Well, yeah, you shouldn't drink clover tea, but all the other teas are probably fine. So where does this come from? In fact, the CDC recommends no. You want to keep your cat when you're pregnant. What you want to do is reduce your risk for environmental exposure to toxoplasma. This organism that cats can transmit cats can only transmit it for the first 2 weeks after being exposed to it, and they get it from catching mice. Okay, so they can also get it from cockroaches too, but they're only going to be shedding the organism that's infective to us for the first 2 weeks. Also, that organism has to be takes over a day, 24 hours before it becomes infectious once it's in the litter. So in other words, or in the garden, in other words, scoop the litter at least twice a day, even if you're pregnant and it's not a problem, although I recommend you use the excuse to get your partner to scoop the litter, might as well. But make sure you wash your vegetables, that anything from your garden, or that you don't actually, that you don't go making dinner without washing your hands. So we want to avoid scooping cat litter if possible. If no one else can do it, wear disposable gloves, wash your hands with soap and water afterwards. Good idea anyway. Scoop litter daily, or better still, twice a day. The parasite does not become infectious until 1 to 5 days after it is shed. Feed commercial dry or canned foods, not raw or undercooked meats if you're pregnant. Keep the cats indoors as recommended. Avoid stray cats, especially kittens. Don't get a new cat while pregnant. Keep outdoor sandboxes covered. Wear gloves while gardening and during contact with soil or sand, because it might be contaminated with feces that contain toxoplasma. Wash your hands after gardening. And there's lots more on, about hand washing, which I think we've actually gotten pretty good at now, thanks to COVID. There was something else I wanted to say there. Oh, the group of people who are at highest risk to toxoplasmosis, I'm still toxoplasma negative as far as I know. When I got myself tested from both pregnancies, and I'm a cat vet, and I've dealt with a lot of cat poop in my time, and I garden, and I test negative. So if you test positive when you're pregnant, you're actually protected. That's a good thing, or before you become pregnant, I should say. That's a good thing. So the people who are at highest risk are people who deal with raw meat. So butchers and raw milk. So that's where you're going to get into trouble. Okay, so cats testing positive with antibodies indicate that the cat's been exposed and won't shed oocysts if exposed again. Cats testing negative if exposed will shed only for 2 weeks before they develop immunity. All right, so here I've talked about this. Now, another reason why you want to keep that litter box nice and clean is because who wants to use a bathroom that looks like this? We want to use a bathroom that looks like this. So let's scoop regularly. The CDC has an excellent toxoplasmosis handout, which is available on their website, as I've listed there. Okay, cats will only eat as much as they need. Hence, why do we have this epidemic of obesity in our cats? We have to just define what need is. Need is more than metabolic or physiologic. It can also be stress eating in cats, distress eating, either because they're anxious or because they're bored. No different than us. Because the happy drugs, serotonin and dopamine, are really the only things that we enjoy technically. Everything's about chemistry. Even love is chemical. It sounds very, very dry, but it's still pretty exciting, I think. So what happens? You come home, your cat greets you because they're glad to see you, and you go, and because you may be carrying groceries in after work and you're about to make dinner, or eat something, or maybe you brought takeout or whatever, you're about to eat something. You say, "Hey, kitty, do you want to eat something too?" And so you offer them food, and the cat goes, "Man, if I ever got them pegged, all I have to do is, if I want food, is rub against their legs," and they've got us trained in 2 seconds flat, and we end up with an obese cat. And what we tend to do is offer bowls that are endlessly full of food, and that is not a good thing. Additionally, we also know that when we, on the top, you can see intact or unspayed, unneutered cats, how dense their muscle is compared to on the bottom, the cats that we see, which are, kind of fluffier and softer. And spaying and neutering does, in fact, decrease metabolic rate. So we need to be preventive, and in order to we need to be careful, and in order to proactive and prevent obesity by starting to decrease the quantity of food that we give our cats gradually, because if we do it suddenly, they're going to win because they'll make a nuisance of themselves. But we want to do that gradually, so that when that over a month or so after they've been spayed or neutered, we're feeding them about 20% less, which means that you have to actually know how much they're eating. Again, how can you say 20% less if you just have a full bowl all the time? So here too is another myth. I used to look at this and go, oh, the food on the right, the nice canned pate, blah, 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 has got to have more calories. In fact, canned food has lower calories, is less calorically dense than dry food. Dry food's kind of like, peanuts at the bar, where you just take, you keep eating 1 or 2 at a time, or chocolate chips, and before you know it, you've had a whomping amount of calories, as opposed to the canned food, which is more filling. So we need to learn to accurately body condition and muscle condition score cats, but we need to measure food, ideally on a scale rather than volumetrically, because it's more accurate. And then we need to communicate to our veterinarians, or veterinarians need to communicate to us exactly the exact quantities to feed, so that they're getting the right amount of calories. And we need to put the hunt back into mealtime. Instead of it being a food bowl that's there all the time, we need to make it work, because that's what they are designed to do. The reason they are such prolific hunters is because hunting provides meals. So if we make them hunt for their food, albeit indoors, then here's one device, for instance, but there's lots of different ones. And we know that we don't want them to have free lunch. We need to make them work for their food, and that's important for their physical as well as their emotional well-being because it gives them something to do. And this website, Food Puzzles for Cats, is really useful in that it not only has, as you can see on the menu bar up here, how to teach your cat how to use a food puzzle, all different kinds of puzzles, including wet food puzzles, and each one is scored with how easy or hard it is for a cat to learn how to use it. So I strongly recommend that you check that out. And the American Association of Feline Practitioners put together a consensus statement saying that that feline feeding programs are necessary in order to address behavioral needs to improve feline health and well-being, not just provide nutrition. So another one is that cats can be vegan. Well, they're not. They cannot. They even last week somebody asked a really good question. What about the vegetarian diets with synthetic taurine and the like? It doesn't work. Cats need animal protein. And so if you're a vegan or you're a vegetarian, and I was vegetarian for 35 years, the cats still got, complete and balanced cat food. And it's just the way it is. Then people will also say that, raw meat is better. And this question, wasn't a question, I addressed it last week though, because I wanted to. The issue with the feeding raw meat, it means the entire animal, none of this human grade stuff. It needs to be the entire animal because that's what cats are designed to eat. And otherwise they get a nutritional imbalance. So byproducts are good. Byproducts are not, you don't want to avoid byproducts. Byproducts are the things that we don't use for human food, but they're definitely important because they provide they provide essential nutrients, and it needs to be freshly killed because just these pictures at the bottom, I put them in to sort of illustrate what happens. You're getting meat that's being handled by people, then it gets shipped somewhere to the store through a truck with a refrigerated truck. Then it gets shipped to then it's in the store where again it's hopefully at the appropriate temperature, but constantly being handled, thawed, different temperatures, all these different things. So I'm all for feeding raw if and only if you kill the bird or mouse immediately before feeding the cat. Then give them the whole animal to eat. That is healthy. There are significant infectious risks for feeding raw. And certainly it poses a risk to people and other animals, children and kittens, elderly people and elderly cats, and those who are immunocompromised. These are just a few of the organisms that can be transmitted and that are very serious indeed. And the cats who eat raw should not be used for hospital or nursing home visits. And in fact, it's a risk to other patients in veterinary clinics to have cats or dogs for eating raw in the veterinary clinic, and some clinics will not accept those patients. So even though it's an emotionally charged topic, there's lots of good evidence for this. There's all these different URLs you can check out. So cats need milk. Well, certainly as kittens they do. And classically, we've got these great pictures here of, giving cats milk and cream and all that sort of thing. And cats can absolutely tolerate milk when they're really young. When they're older, many cats can tolerate milk, but other cats do become lactose deficient. And then if you want to give them milk, you can give them lactose-free or lactose-free milk, or even like cat milk that you buy is lactose-free. What about grain or carbohydrates? Are they bad? Well, certainly the native diet from cats when they eat a bird or mouse is 52% protein, 46% fat, and only 2% nitrogen-free extract, which means, grains or carbohydrates. And that, so it is a very small amount, but that doesn't mean that it's bad for them. Cats regulate the macronutrient composition. If they're able to make their own menu, this is what they'll do. They will choose something that's up to about 12% carbohydrates. But cats, while they have a limited carbohydrate digestion, and they absolutely can't do sugars, glucose and fructose, and they lack a sweet receptor in their mouth because they don't normally eat sweet things, birds and mice, but they can digest carbohydrates in manufactured food efficiently with 85 to 95% digestibility, depending on the source, the processing, and their life stage. Okay. Rushing right along. You can't train cats, or dogs are smarter than cats. That's not true. Learning is ongoing. It's just that cats will only do something if they're interested in it. There's associative learning and classical conditioning. And this is what we want to do. We want to pair a biologically potent stimulus, such as, food, for instance, with a previously neutral stimulus, such as a can opener or a click, and cats will assume something's good's going to happen. And we do this every night with my cat. One of my cats needs subcutaneous fluids every night, and he starts herding us around 8 o'clock to give him his fluids. Well, actually, to give him the treats that he gets when he gets his fluids and the attention. So, and same thing with nail trimming. You could also pair these things, and this is what we're also trying to do in clinics. There's operant behavior, which is freely emitted. It's a behavior that the cat normally does. There's no obvious triggering stimulus, and it's susceptible to reinforcement and punishment by its consequences. Now, this is a really nice video. We don't really have time to do all of it, but this shows training this kitten.
So now we're going to train him
to get into a carrier.
So this is a carrier, and I'm going to think that he's naturally probably somewhat inquisitive. So we'll see if he decides to go in it at all. And if I have to, I've got a little toy here to kind of encourage him. He's clicked and rewarded for going in the crate, or at least an approximation of getting in the crate. Okay. Now I'm going to get him out of the crate. Okay, bud, let's go back in the crate. Boy. He comes, he knows to look for the treat when he hears that click already. It only took him a few moments to get that down. Okay. Oh, good boy. Good in the crate. See if he just offers it on his own. Good boy. So now we're just capitalizing on offered behavior. He's getting in the crate, and I'm clicking and rewarding for that behavior. And if he offers more of it, like getting all 4 feet in, then we'll click and reward again. Good boy. So he's in the carrier, and he's a very good boy. Good boy. Good boy. Okay, so you get out. Now we're going to see if he'll get back in the carrier. Okay, get in. Get in. Don't wait for it. So I want his automatic reaction eventually to become, when he sees the carrier, to run right in it. And so that's why we're doing this training, so that we won't have trouble loading him up before we go into the carrier later in life when we need to take him places. So we're going to practice this until he gets it down, and every time we bring the carrier out, he'll dive right into it. Good boy. And then we'll do this maybe once a week, maybe once every couple weeks, as he's older, just to maintain the behavior. so that he willingly enters it every time. So it's pretty simple.
So that's Dr. Jackie Nielsen and her kitten Bugs. And so it's really useful. Here you can see with, one of my cats, he's learning, this is the first time he's seen this feeding puzzle, and it's natural behavior for him to move it around. And he's going to self-reward by finding food that way. Then I went to a more difficult type of puzzle, one that, we make and have for clients, where here, I'm putting some food on top. He has a Birds Be Safe collar on, food on top of it, so that he starts learning that if by investigating this, he's getting food. Cats learn very, very quickly, and I won't play this right now, but this is absolutely fascinating what these cats will do. The URL is at the end of the presentation as well, so you can look at it yourself. Now, and carrier training is really, really valuable because it actually reduces stress to veterinary practices. This group of cats were accustomed to a cat carrier and transport by car. It reduced signs of stress during car ride. It made the veterinary examination faster, and so it was all in all much better for the cats. And here on Facebook, proof that leaving the cat carrier out can lead to it being a comfortable place. Oh my God. Heart, so just leaving the carrier out, and so that the cats that are familiar with it, and it's associated with napping and treats and catnip and meals and privacy and all those good things. So training cats is not difficult to do at all. One of my other cats, he does high five, low five, touch right, touch left, sit up, and various things like that, just because it's his way of making me do things, namely give him treats. So it's hard to change human behavior. Well, we are often the sticklers in things where we say, well, I don't want to give fluids, or I don't want to this, that, the other. We can certainly clicker train people, but that's not yet generally accepted. So there was a very nice interview on the Canadian Broadcasting Corporation, which talked about why your approach to changing people's minds is all wrong. And this goes to, whether we're talking politics or whatever else it might be. This person, used to put a lot of stock in the idea that reason could influence people's decisions. She was a philosophy student at Princeton and a champion debater, and it was a big part of her identity, using reason. But when she tried to convince men that women didn't like being catcalled, she realized that reasoning with them actually didn't work, because decision-making isn't just about facts and conclusions. And as we've all seen, people will bend themselves in unbelievable cognitive loops trying to avoid the sensation of loss that comes with admitting that they were wrong. And if there's one important lesson she's learned from her research into the reasons why people do or don't change their minds, it's this: if you want to understand reason, if you sincerely want to understand how we can do better at changing other people's minds and our minds, you will need to do a better job of engaging with what makes us human. It's about emotions, because the flaws and the foibles, but also the ways that we think, all go into reason in a way that we need to understand. So it's not enough to give facts to people who don't want to be vaccinated, or facts to whatever it might be to change people's minds. You have to connect with them. There needs to be a clear emotional investment. Okay. So, because it's already, to me, pretty amazing that people bring their cats into the clinic at all. The trip in the car is, in general, traditionally not a pleasant thing. We feel pretty guilty by the time they come in, and by the time we arrive with our cats. Additionally, they may have vomited or defecated or released their anal glands, or urinated, or who knows what. They certainly often will have made a lot of noise. So they come into your absolutely beautiful clinic, and they hear barking, which is distressing to both the purse cat person and the cat. So it takes a lot of courage for them to come in. So people feel guilty. We believe that our cats are going to make us pay for this, and plus we're supposed to give treatments. I'm just constantly amazed that people are clearly so dedicated that they go through this, and guess what? They get to book another appointment and pay for it too. So I'm pretty impressed with people. So we need to make it really easy to give treatments because we want either something that tastes so good that the cat eats it on their own, or we use topicals to make it a lot easier, making it easy to use or fun to use, different, with a hunting feeder or treats for whatever we're doing, and work with rather than struggle against human behavior. We need to recognize that people, we as people, it's actually a lot easier for me to give my cat fluids every day because it becomes part of my routine and it becomes a habit, rather than just doing 3 times a week, in which case I'll look for all kinds of excuses to not do it. Do I have excuses for not brushing my teeth? Of course not. I just do that twice a day. So change comes from within, and we need, as veterinary team members, we need to believe that cat parents can and will if we let them do that. Okay, getting here to the end. If they're purring, they must be happy. We have a belief about that. Well, actually, not necessarily. Purring releases happy hormones. Okay, and so that makes the cat feel better. Is purring always equal happiness? Well, it's a way to self-medicate with, some of these happy drugs here, endorphins and things like that. So they're self-medicating. It's also a social gesture, much like a smile, but we'll smile at somebody we're actually quite frightened of in order to placate them. So it isn't necessarily, it may be that a cat is in a lot of pain and is just saying, don't leave me, please stay with me. And so it's a solicitation as well. Plus the way the frequency is believed to facilitate healing. So it's also helpful for us, and you can use this website called Purly, and you can put this on your computer. That's where I got this from, and you can use the sliders and change it to different characteristics, which is pretty neat. All right, the cats have 9 lives and they always land on their feet. Well, actually, they don't. Feline high-rise syndrome, falling from 2 or higher stories, even if they do land on their feet, it results in trauma, especially facial, dental, hard palate fractures, limb fractures, luxations, hip luxations, etc., thoracic trauma and shock. If, however, it's higher than the 7th story, it's more severe and higher incidence of thoracic trauma. So much for that theory. But do cats have 9 lives? No, they're just extremely agile and dexterous and intelligent, plus they have purring to help them heal. So as much as we'd like to think that they have 9 lives, that's not. They have no more than we do. Okay, cats are aloof. Cats are self-reliant. They with this belief that they hate all sorts of things. No, it's not true. But they don't need us. They enjoy us. And they get benefits, not only being fed, etc., but they don't need us. And they're also not codependent at all. So that's one of the things I really, really like about them, is that they're not codependent. They're always cautious because they're not only predator, they are also prey animals. And therefore they operate under the, I need to check out what's going on to make sure I'm safe. And sometimes that doesn't work, but they also are more likely to, their first way of preventing harm to themselves is to run away. They need consistency and predictability, socialization. Their sensitive period is between very, very young, 2 to 7 weeks of age, while they're still with their mums, long before we even get to meet them. We should ideally expose kittens to at least 4 handlers and gently introduce them to many brief, positively reinforced experiences. Cats, when your cat comes and jumps on your keyboard and is a pest cat, and then they go away, and then they prefer more frequent, less intense interactions with people than we might like. You don't take a cat out for an hour's run. You don't take a cat out to play frisbee with them or to meet other people in the park. So that they are not they like small, frequent doses. And they like to choose the time and place of the social contact. And if the more we respond to that, the more likely they are to leave us alone, get off the keyboard, and the stronger the bond will be, though, just by responding to when they come to us. All right, so this is kind of fun. So how to introduce yourself to a cat. If you've not met this cat before, there are several steps. You want to do the slow blink. A slow blink is a hello. It's like a smile. So we want to make sure that we do this, a slow blink to a cat. And when you do this to your own cat, you'll be I just still gobsmacked when my cats slow blink back at me. The next thing you want to do, as well as the slow blink, I'll just turn that off for noise, is you want to chirp. So I slow blink and then I at the cat, and that's a greeting. That is a really friendly greeting. And let me tell you, when I've had cats, greeting me with, and I go, they kind of go, you can see this air bubble with WTF in it, because I'm clearly, showing that I have pleasant intentions rather than going, oh my God. Then the next thing we want to do is let them smell us, so that they can, because smell is their most important sense. You don't necessarily have to put your hand right there. And if they are in a confined space, make sure that they don't feel trapped. Give them the option to see an exit for themselves. Now, another thing too is when you go and stroke a cat you've just met, you do not have permission to stroke behind their head until the cat gives you that permission. It would be kind of like me reaching out to shake your hand, if we're ever going to do that again, shake your hand. And when you reach out to me to shake my hand, I instead grab your breast or your groin. That in our society is completely unacceptable. And so too with cats, stroking behind their head is unacceptable for their culture. So wait until they give you that permission. Now, cats in water, some cats really like water. I won't show you this video in the interest of time. There's also a video on YouTube, but this is of my friend's cat on the left-hand side who just loves water. Some cats really like it, Turkish Vans in particular, but in general, they're not hugely favoring of water. So cats can see in the dark. Well, no, they can't, but they do have they do have eye shine that is due to the light bouncing off of the tapetum lucidum, the back layer of on their retinas, which which magnifies what they can see. So what we would see, if it's really dark, for instance, they are going to see the upper, whereas we might see the lower. Also, cats, because they have different proportions of rods and cones, because what's important for them for hunting is movement, they don't have such, they're not really great at seeing color. So what we see at the top, they see at the bottom of this picture. They're sort of red-green colorblind. It's similar to that, but it's not identical. All right, so medieval myths, all kinds of myths. Cats will steal your baby's breath. Cats are scorned women who like to eat babies. They'll eat you for Christmas dinner. Cats cause the Black Death. Cats are lucky, especially in Japan, especially if they're a tortoiseshell male, which are, there are a few of those. They're lucky in Russia if they're blue, if they're polydactyl if the person is a sailor, gnarly and old if they're in China, and yet we also have black cats are unlucky. Then what other myths are there? Cats are urns for the souls of very holy humans. I like that one. The cat Sith haunt the Celtic countryside looking to steal souls. That's Irish and Scottish. Cats work for the devil. Cats predict the weather, and pregnant cats shouldn't pick up a cat or let them sleep on their lap because the baby will end up looking like the cat. So this is that one from, Iceland. You need to have new clothes on Christmas or you will be eaten by a giant cat. Good enough reason to get clothes for me. All right, so just resources and videos that I wanted to share with you. This is a really fun one. You've maybe already seen this one. It's a TED, a little TED talk, the history of the world and it according to cats. It's fun. I've shown you this one. I wanted to show you all of them, but I don't have enough time. Here's a resource that you might find useful regarding ticks. This is that video with circus cats, and these cats are really well cared for and they are happy, well-adjusted cats. Here's the purring app that you well, it's not an app actually, you can only have it on your computer. And here's a video of cats who actually like to swim. So with that, I'm going to stop sharing and get finally 16 minutes over. Again, I apologize to questions. So JJ, let's go to her.
Thank you so much, Dr. Scherk. That was really excellent. Let's do a couple questions. Okay, we have a few here. A couple that are a little specific, but I'll just get them out of the way because I still think they're good questions. Do you know about statistics, any statistics about ticks in South America, cats and ticks?
Okay. So
or maybe a resource we could send them to?
Yeah, well, always I go into Google Scholar whenever I'm traveling to different places in order to familiarize myself with the prevalence of different organisms. And ticks are very definitely prevalent in South America. They tend to be in the warmer climes, not so much high up in the Andes, but they certainly, depending on the type of tick, there are most definitely ticks, lots of ticks in South America.
Yeah, I agree. You addressed this a little bit, but I think maybe we could just expand on it a tiny bit. We have somebody that has a lot of experience in feline behavior and is a veterinary assistant. She's asking, what do you think is the most vital thing that we should teach cat owners when they go for a veterinary visit?
I think probably that carrier training, so that cats are comfortable in the car and comfortable in the carrier, so that it's not as freaky. And then when they depending on the cat and the clinic, I mean, now of course everybody has to stay in the car with their cat, but under normal, whatever that is, circumstances, some people may still want to stay in the car with their cat in the carrier, or bring the carrier into the clinic but cover it with a towel, with enough light that they can, so that they don't feel trapped, but that they can feel safe. And don't put the carrier on the floor. The carrier should stay on their lap or be on the seat beside them, rather than on the floor in the clinic where other cats or dogs might investigate them.
And what do you think about, so just on that topic, just, pheromone therapy for veterinary visits?
Yeah, so certainly Feel Away at one point, I think they've discontinued, had Feel Away wipes for the carriers, but now Feel Away makes two different pheromone, or produces two different pheromones. The cheek pheromone, which is a territorial one, making it's kind of like a good housekeeping seal of approval, and there's also the appeasing pheromone, which is for socializing, which is about, and it's from the mammary glands. It's from that region anyways, is where it's secreted, male or female. And so that one's called so the classic one is the cheek pheromone. And certainly having the diffusers plugged into the clinic and changed on the first Sunday of every month, refresh the first Sunday of every month, really helps cats in the clinic. And certainly cats can, having the carrier infused with or sprayed with Feel Away before the trip, if the cat isn't used to the carrier, that might help, but make sure that you let it evaporate for 10 minutes, because it's in an alcohol base, and that cats do not like the alcohol base. So that can also be helpful if you're, when you leave your cat in the clinic, because they're sick, or because they need to stay in for a procedure, dental work or something like that, spaying or neutering, if you do take along something with your pheromones and smells on it, leave a sweater or a t-shirt or something like that, and you could, if you wanted to, spray that at home with some pheromones, and then put that on, because this is really important for them.
The lady that asked that question says, thank you, and it's a pleasure to hear from you. And she's sending a virtual hug from Argentina, Buenos Aires.
Thank you. Thank you.
Which I think is wonderful. I'm not sure what time it is there. It's a big.
Oh, it's just 2 hours different. It's is it 2 hours, or is it 5 hours?
I think it's a little more.
It's later. It's later. Yeah.
So this is a big topic, but maybe we can just touch on it just briefly. The whole dry food versus wet food debate with cats. I know it could be a whole lecture in and of itself, but maybe we can just give them a quick rundown, so people know what to think about for that.
Sure. So, dry food is extremely convenient. That's its big thing, is that it's very convenient. Cats don't have to eat a lot of it in order to get complete and balanced, not only complete and balanced, but adequate nutrition. The problem is we put out too much of it. And, and if you're stuck indoors all the time, what else are you going to do other than eat? So we end up with, risking obesity. Additionally, dry food has in one study was shown to in one study was shown to be being fed just dry food was associated with a greater risk of developing chronic kidney disease. That was actually a very interesting study. But I'm not going to say that there's a direct connection there. It's certainly not a cause and effect. Dry food does not cause kidney disease, absolutely not. But dehydration plays a role. And cats need to. This is the other thing with using feeding puzzles. The more a cat has to, the more often a cat eats multiple small meals, the more water they drink, and the more water that they therefore take in, and that's good for their system. Whereas if they just have a bowl, they're not going to drink as much water. Canned food really is more similar to birds and mice than dry food. Birds and mice are about 70 to 85% water, or I should say about 75% water, depending on how healthy that mouse is, et cetera, et cetera. They could be dehydrated too, but they're generally about 75% water. Canned food is about 70 to 85% water. Dry food is less than 10% water. So it's a very different thing. Now, the thought that dry food is better for teeth and canned food's bad for teeth is not true. So dry food, if you think about a piece of kibble, let's say, actually, I've got, maybe you can see this, my nasty habits, gum, a piece of gum here. If this is a tooth going into that piece of gum, into that dry kibble, because it's dry, the tooth, it will clean the tip of the tooth, but not all the way up to the gum, unless it is a specific dental diet. If it is a dental diet, it will help clean the gums. But other than that, you just have cats with nice clean tips of their teeth. But that's not what we're after. We're after healthy gums instead. So, and canned food does not at all promote dental disease.
Fantastic. I think that we're going to wrap for the evening because it's very late for a lot of people.
I apologize.
No, it's great information. Are you kidding? This is fabulous. The more we speak about this, and like the more we could just, really go into even more about cats. It's just, I just love them so much. Thank you so much, Dr. Scherk, for an amazing two-part presentation. Again, for people who weren't here last week, you can go on our website and watch the first presentation. Just really excellent. We really appreciate it. So before we wrap things up, I'd like to extend an invitation to our guests for some of PetSpace's upcoming events. For those with little ones, we're hosting an Earth Day celebration on April 22nd, complete with games and crafts and puppet shows and a pet encounter. You can register for this free event on our website. And then we have a fascinating online Animal Matters session at the end of the month on April 29th. Drs. Meechan and Dr. Zazula will be giving us a special look at the mummified Ice Age wolf pup, Zur, that you might have seen in the New York Times not too long ago, and other frozen fossils from the permafrost up north of where Dr. Scherk is in the Yukon Territory. Their findings are fascinating and really incredible, and I personally can't wait to see what they share with us. And then all the registration links can be found on our website, www.annenbergpetspace.org. So thank you again, Dr. Scherk, for taking the time to share all of this great information with us. This presentation will be on our YouTube channel in the next couple of days. So if you want to refer back to it, and also we're able to share our notes in the chat. So thank you again, Dr. Scherk, for sharing that with us. Thank you everyone for joining us this evening and for continuing to support Wallace Annenberg Pet Space.